and thank you for joining us on this episode of Inside View. I'm Cory Burnell, and I'll be your host. And we're joined by Dr. Dean Kelaita, who's our local health officer here in Calaveras County. So thank you, Dr. Kelaita, for joining us and having a discussion with us.
My pleasure. Thank you for inviting me, Cory.
Well, you're welcome. So as our local health officer here in Calaveras, tell our viewers a little bit about what your role is, your responsibilities, and how you serve them.
Every doctor in California, or every county in California, I should say, has a local health department. And every local health department has a physician who oversees the medical functions of that health department. That's called a local health officer. And that's what I do for Calaveras County. The health officer also has responsibilities for disease control activities, for preventing outbreaks, and responding to health threats to the community, which is what we're dealing with this new novel coronavirus outbreak.
Mm-hmm. Well, I imagine as the broad scope of this, you're probably coordinating with other counties and, of course, state officials, right?
Yes, we're coordinating with lots of people on this.
Okay.
We take direction from the federal government through the Centers of Disease Control and Prevention in Atlanta, Georgia. Mm-hmm. We work with our state public health department, the California Department of Public Health, and we also deal with other local partners as well. Right now, we are in an emergency operations mode, and so we're dealing with our county Office of Emergency Services. We're dealing with other response partners to manage this outbreak and protect the citizens of Calaveras County.
Yeah, absolutely. Well, Dr. Kelaita, how long have you been in this role here in Calaveras?
I've been practicing as a family practice doctor here since 1996, and I've been the health officer for Calaveras County for 20 years, since 2000.
All right.
So I've seen some similar situations like this come and go, but nothing to this severity and magnitude.
Mm-hmm. Well, let's talk a little bit about that. Our viewers, we're going to be talking about COVID-19 and this coronavirus outbreak. So, let's go right off the top here with, the current state of it here in Calaveras County. Of course, we get a wealth of information about what's going on around the world and the nation from our national news media, but it's hard to know what's happening right here in our own backyard.
Yeah, and so I'll give you some information about what's happening in California and even Calaveras County specifically.
Okay.
So I pulled some information off that's recent, and this is a pretty rapidly evolving situation.
Okay.
In California so far, there's been 598 positive cases of COVID-19 and 13 deaths. The breakdown of ages that have been seen in the positive cases are 13 cases between the ages of 0 and 17, 392 cases between the ages of 18 and 64, and 188 cases for those above 65 years of age, 5 whose age we weren't sure of. Most of these cases are now considered community transmission. That means they haven't been brought in by somebody who just stepped off a plane from China or Italy or some far-off part of the world where this activity is taking place, but rather those cases have been acquired locally from one person who has the illness transmitted to a person who doesn't.
Okay.
In Calaveras County, we've had 2 confirmed cases in residents of the Copperopolis area. A parent who worked as a healthcare provider in a distant community came back with the illness after having been exposed to it as part of their work and infected a child in the home.
Okay.
The child in the home attended the Copperopolis Elementary School, and we had a lot of exposed children, staff, teachers to that child in the school. So the health department did something called a contact investigation where we interviewed over 60 people who were exposed to that child as part of the kids attending school. And we ascertained detailed information on those people as to whether they were sick or not. Some people who did develop symptoms of illness, fever, cough. I'll talk about what the symptoms are of coronavirus infection in a minute. They developed some of those symptoms and they were tested, and everybody's been negative so far to date. So we've had no community transmission of coronavirus to anybody else in Calaveras County around those 2 positive cases that we've had.
Okay, now the child in the 2 positive cases had no symptoms?
No, the child was ill. The child did have
symptoms.
classic symptoms of coronavirus infection, yes. That's how it was picked up.
Okay. And that's perhaps, we hear a lot of things about, well, children don't get sick from the COVID-19 virus, and that may actually not be very accurate.
It is true that children aren't high risk for developing severe complications of the coronavirus infection. They'll still usually develop a milder form of illness, which includes fever, cough, respiratory problems. They just don't go on to get those more severe symptoms that result in hospitalization, respiratory failure, and even death.
Yeah.
That's been seen primarily in older patients.
Well, and we're being told, so I'd like your opinion on the accuracy of this, that those who are getting to critical stages or dying from it have already had complications, respiratory issues when they've acquired the disease and the symptoms?
Yes, there are people who are considered high risk if they get the coronavirus infection to develop those more severe forms of the illness, including hospitalization and death. High-risk people are older people over the age of 65. The majority of the deaths that we've seen, not only in California but nationwide, have been in people in the 80 to 90-year-old range.
Right.
But suffice it to say that people over the age of 65 are considered high risk, or people even under 65 who have other health problems, chronic health conditions, heart disease, diabetes, lung disease. People who smoke, have a chronic obstructive pulmonary disease. Those people are very much more at risk of those more severe complications from coronavirus infection if they were to get it.
So as people think of their own susceptibility and their risk of severe complications, is it fair for them to say, well, somebody might be saying, well, I'm 70 years old, maybe I'm at very high risk, but they're otherwise very healthy, their lungs are strong, they don't have other immuno problems. Should they rest easier because of that?
Well, they are still considered high risk. So if people are over 65, even if they are healthy, they're considered at higher risk than people under 65. You can have a lot stacked against you. If the older you are above 65, the higher your risk. And if you are a person who has other health problems, then that stacks the deck against you. So those still are people who are considered high risk if they're over 65, even if they're active and healthy and have no other health problems.
Okay, so good to know that act accordingly then.
Yes, we always
take the precautions.
Yes, our recommendations, which we'll touch on, are for especially people who are high risk for complications of coronavirus to be even more vigilant in protecting themselves.
Okay. Yeah, would you like to go into those at this time, or did you have another item you wanted to touch on first?
Yeah, I think it'd be important for your listeners to just get a little bit of basics about what this infection is. Coronavirus is a family of viruses, and they're not new. Coronaviruses have been causing routine respiratory problems, common colds, have been around for a long time. Those are routine coronaviruses. Coronaviruses are in the category of types of viruses Dr. Smart was talking about earlier that can cause illness because they change rapidly. They can mutate. And so they can become different, they can change, the surface proteins that the immune system recognizes can change, and then you can get a new strain that's never been seen before. And that's what we're dealing with, this new strain of coronavirus, a novel strain of coronavirus. That means it's new. So the immune system of anybody in the world has never seen this before, so there's no immunity in the population. And so everybody's susceptible to getting this illness because there's no immunity that's built up in the population. And if it causes severe disease, which it turns out this one is doing, then those are two ingredients which are quite bad, and that's one of the reasons why we're very worried about this.
Yeah, absolutely. Well, let's talk a little bit then about transmissibility, and because we're being told this is a bit more contagious than the common cold and the flu, right?
Yes, this is very contagious. Well, routine influenza and common colds can be quite contagious too. But our experience so far about this virus is that it's highly contagious. So people who are in close proximity for more than minutes and hours can have a potential for transmitting the infection from one ill person to another. So the way it gets transmitted is through droplets from the respiratory secretions from a person who's sick. If I'm coughing, if my nose is running, if I cough in the air and you breathe that in, if I cough into my hand and shake hands, if I touch surfaces, then the virus can be transmitted to other people if they rub their eyes or if it gets in their nose or their mouth. And so that's mainly how it's transmitted, is from person to person, from a sick person to a non-sick person, through exposure to those respiratory secretions that a person releases when they cough or sneeze, and through hand contact from one sick person to one well person. That's the mode of transmission of this illness.
And we're finding that the virus can live for a while on surfaces, so hence the importance of disinfecting things that are frequently touched.
Yes. Viruses oftentimes can live outside of a human host for certain periods of time. Each virus is a little different. This virus, we're estimating, can live on surfaces for several hours to maybe even a day or two. And so it's important to do routine disinfection. Hand washing is one of the most important ways to prevent illness, and cleaning of surfaces, doorknobs, countertops, toys, those kinds of things that can serve as objects that can transmit the illness from one person to another.
Sure, and yeah, you mentioned coughing or sneezing into a hand. That's not probably the most sanitary way to protect yourself, coughing or sneezing, right? Because you then touch things with your hands.
Exactly.
So hence the frequent hand washing if you're in the habit.
Yes, and you'll see people be recommended to cough into their sleeve or cough into their elbow, to use tissues, Kleenexes, that kind of thing as well.
And then go wash.
And the routine symptoms of coronavirus people are probably familiar with. Cough is probably one of the most common. Fever is very common. Over 90% of patients with coronavirus infection we're seeing mount a fever. A fever we define in healthcare settings as temperature greater than 100.4. Not 104, 100.4 would be the definition of a fever. So a fever and cough and respiratory symptoms, shortness of breath, those can be suggestive of coronavirus infection. The problem is that those can be routine symptoms from other routine symptoms of other respiratory illnesses that people can encounter during the winter time. So not everything that causes a person to be sick is coronavirus, but those are the typical symptoms of coronavirus, and they can be shared with other illnesses as well.
Okay, now let's talk then, once we see those symptoms, what should drive a person to seek out a COVID-19 test?
Well,
the presence of one or all symptoms?
Well, those symptoms of a fever and respiratory symptoms, cough, shortness of breath, and usually there's something else that tips us off that coronavirus infection is going to be more likely. For example, a travel history. A person just traveled to an endemic part of the world where coronavirus activity is happening more commonly than it is here in the United States. Those countries include China, South Korea, Singapore, Italy, Iran. So travel history within the last 14 days of one of those coronavirus endemic countries, along with those symptoms, makes a person very much a suspect for coronavirus infection. Another historical feature that a person tells us is that they've had contact or exposure to a known coronavirus case. They had an exposure, like, for example, some of the children in the school where we had our positive case in Copperopolis. Those children, if they became symptomatic with fever or respiratory symptoms, would be very much suspect and should be tested right away. So, and then there's a kind of a little bit of a broader category now of people that we suspect the infection in and would recommend testing more. Because we've seen community transmission, as I mentioned before, we've seen cases of people have coronavirus and there's no other explanation of how they got it. They didn't travel, they weren't exposed to anybody that we know that has it. They get in a hospital, they wind up in an intensive care unit, the doctors test them and they're positive. So that's called a case of community transmission. That person acquired the infection for ways that we don't know and we can't explain. So that's a much more serious situation, and we're seeing that now, with community transmission in California. And so now the testing recommendations are broadening to include people that might be sick enough to be hospitalized, and yet we don't know what's wrong with them.
Okay.
The other tests don't show anything. Then we go ahead and test those people for coronavirus too. So we still like to have a little bit of reason to test somebody more than it's just a routine respiratory illness, which is quite common and can be explained by other things.
Mm-hmm. So let's talk about the status of test availability here in Calaveras County. Where are we at there? Do we have plenty of tests if necessary for those who, appropriate? It seems appropriate to test
Testing
them.
is still limited,
Okay.
not only in Calaveras County, but in California, but nationwide.
Mm-hmm.
Many of your viewers will follow the news about the limitations in testing that we're experiencing because the laboratories don't have all the testing capabilities that they need, and it's not as easy to get a test as we would like to see. And without testing, we don't know the extent of the outbreak, because a case is a person who tests positive for the infection. And so without more widespread testing, we don't have a good handle on really what's the occurrence of the disease out there in the community. So we really need to ramp up testing. So right now, if you're a resident of Calaveras County and you are sick or you think you might have been exposed to somebody with coronavirus, you're not sure, you want to inquire about testing, you can contact your medical provider.
Okay.
And your physician. We are working with physicians in the community to share information and facilitate testing for people in the community.
Okay.
And so through the hospital, through the medical clinics, through the local medical providers, we're working to roll out and improve access to testing for coronavirus to get to the point, hopefully, that people who want to get a test because they're concerned can get a test. That will be ultimately our goal, because the more testing that we can roll out, the better we can get a handle on this epidemic, statistically and scientifically, and that's our goal. But right now, we're not quite there yet.
Yeah. Now, is talk that there are infected people who don't exhibit much in the way of symptoms. So a wide varying degree, is that the case that we're seeing here of symptoms
We
or
think
severity?
that may be the case.
Okay.
Most illnesses, viral illnesses, can not be spread until a person becomes sick, until they get symptomatic.
Okay.
Some viral illnesses can, like for example, influenza. If I start to get a cough, I'm running a fever, I feel sick, I could have been contagious up to 24 hours before I knew it. Because there's a period of time we call pre-symptomatic, where a person is able to transmit the illness to another person before they had any symptoms at all. Other coronavirus infections like SARS and MERS, they did not have that pre-symptomatic phase of being able to transmit the illness. Once you got sick, then you can pass it, not before. And so that's kind of been the assumption for this novel strain of coronavirus, because it's another coronavirus. And our experiences with those coronaviruses is that you probably can't transmit the illness until you become symptomatic. We're seeing reports now, especially from Massachusetts, of cases where people have acquired the infection or transmitted the infection and were relatively asymptomatic at the time. And so that's a bigger concern, because most of our efforts are geared towards getting people tested once they become symptomatic. And so that changes things a little bit for us.
Begs the question, though, once somebody recovers from the virus, of course their body has antibodies now at this point, right?
Yes.
Can they then spread the virus at that point?
Once a person's tests positive for coronavirus, how do you know when they're not sick anymore?
Sure.
How do you know when they're
Yeah.
not contagious anymore to other people? We retest them.
Okay.
So it takes several days, usually on average 2 to 7 days, before a person becomes well and does not shed the virus anymore in their nasal secretions and their respiratory secretions. So if someone's positive for coronavirus, we'll retest them again days or a week later.
I
And we
see.
want to see that test go from being positive to negative. In fact, we want 2 negative tests at least 24 hours apart.
Okay.
That way we can document that the person is not shedding the virus anymore, they're not contagious anymore, and then it's okay for them to return to school, to work, or what other setting they're in that they may have exposure to other people.
Mm-hmm. Well, okay, so we've talked quite a bit now about transmissibility, and it does kind of beg the question about whether people should take extreme measures like wearing a mask, or is just really, I guess the point we're at right now is social distancing is kind of the recommended norm.
Right. You've seen a lot of changes in life over the last week, and the reason is that we want to get in front of this infection, and we want to diminish the conditions in which the virus can spread and be transmitted. And so, since it's spread person to person, if you can increase the distance between people, then we think that you can decrease the potential for transmission of that virus from one person to another. That's the whole concept behind social distancing. In countries that have done a good job in instituting some of the things that we're now rolling out, like closure of mass events, concerts, schools. We've had school closures in Calaveras County, restaurants, wineries, bars, pubs. Closure of these venues where people get together is the most effective strategy, community mitigation activity to reduce the transmission of it. And if we can reduce or maybe spread out or delay the transmission and keep everybody from getting sick all at one time, we can prevent the healthcare system from being overloaded and impacted. And I have
let's look at your
a
graphic
graph
here
that I'd like to show to your viewers. And what it shows is in the orange peak, that's what happens with the number of cases on the vertical axis versus the time on the horizontal axis. So you see the same number of cases in each of these two graphs here, but with no protective or social distancing or community mitigation strategies. You see all of those cases all happen in a short period of time, and you exceed the threshold that the healthcare system is able to absorb. If you can institute social distancing measures, you can delay the onset of cases, and the same number of people may ultimately wind up getting sick, but you can keep the numbers down so that you don't overload the healthcare system. Because in not only Calaveras County, but across the United States, there's 1 million hospital beds across the entire country. And at any one time, 700,000 of those hospital beds are full with people who are there for other problems.
Sure.
They've had heart attacks, they've had surgery, they've had infections. They're full. So there's not a lot of excess hospital bed capacity in America. And all those beds there's 35 million hospitalizations a year in the United States, so people rotate through those beds. But the point is that there's only a certain number of beds, and they're full most of the time. There's 46,000 ICU beds in the entire United States. In Calaveras County, we have an acute care hospital, Mark Twain Medical Center. It's licensed for 25 beds, and it has 6 ICU beds. So at any one time, a lot of those beds and ICU beds are full with other people.
Sure.
So if we can delay or prevent this COVID-19 infection from having so many sick people that it overloads our local healthcare system, then that's going to be a victory. And that's why you see a lot of the measures that are taking place. People say, I can't go to the gym, I can't go to the bar, I can't go here and there, this is bad. This is an overreaction, right?
Yeah.
It's not. If we can put these measures into effect now, and we can aggressively delay the transmission of this illness from person to person through these social distancing measures, we can spare the hospital and medical care system from being overloaded, and we can save lives. And that's the whole point of these measures that are being put into effect now.
Yeah. Well, yeah, the criticism of it being an overreaction, people think, well, there's 2 cases in this county and we're shutting the schools down, right? I mean, I can see that's a natural reaction, of course. And certainly what you're talking about here makes perfect sense in that it's not a matter of, I guess, people getting sick. That's going to happen, and we're going to get through it, and the immunity to the virus is going to occur over time, right? But it needs to be over time that's manageable. Is that really the message that we need to be talking about?
Yes, we need to prevent the overloading of the healthcare system, because it's estimated that when people get COVID-19, coronavirus infection, about 80% of people will get a relatively minor disease, sort of like a routine flu. But 15, maybe as many as 20% of people are going to get those more severe symptoms and require hospitalization, require intensive care, require being put on a ventilator. And there's not a lot of excess hospital capacity in our local community and across the state and country to absorb that kind of influx, of a surge of people into the healthcare system. So that's one of the reasons we're instituting these social distancing measures at this time, is to spread out and prolong that illness. And another reason is that if we can delay things, we can have time to come up with therapies for this. Are there certain medications? Are there antiviral drugs? Are there things that we can give to people? If you go to your doctor and you have the flu, you could get a prescription for a medication that's called oseltamivir or Tamiflu. And that can reduce the duration of the infection and even prevent people from getting more serious problems from the flu if they were to get it. Another thing we can do if we can prolong this is to come up with a vaccine. So a vaccine that's effective against this novel coronavirus would result in the ability to institute immunity across the whole population, especially those at-risk groups. And we would see cases of this drop off significantly. So those are the reasons why we want to put these social distancing measures into place right now, because these community mitigation strategies are the only thing we've got right now.
Yeah, you're right. There is no other. There's just no treatment other than our own immune system. So we've got to. You're making a perfect case here. We're down to a couple of minutes, and I'm a little discouraged because I feel like we could go for a whole hour on this subject. I do want to ask you then, is there some light at the end of the tunnel with seasonality, perhaps, like there is with other coronaviruses?
We don't know. Some viruses have that seasonal variation. Influenza, for example. It's more prominent in the wintertime, and it's almost unheard of and not seen in the summertime, in the warmer seasons. Coronavirus, this novel coronavirus, COVID-19, we don't know yet. We don't know if it'll have that seasonal pattern or if it will be with us on a year-round basis. We're just not sure yet. We haven't had that time to gather that data and that experience.
Well, yeah, then the idea being here, well, we just have 30 seconds left, but I guess let's leave our viewers with a little bit of hope here in the time frame that we're looking at the social distancing being in place.
Life's going to be different for the next couple of months. So that's something I think people are going to have to accept and participate in. If people hunker down, if you are at risk, you need to take common sense measures. Wash your hands. Don't get yourself into situations where there's lots of other people. Limit your exposure to large groups, especially if you're a person at risk. And there are things people can do, and these things help. Washing hands regularly, avoiding touching the nose, mouth, cover your cough when you sneeze or cough, avoid contact with people who are sick, and then following guidance from your local health officials about social distancing, about when we can start to reopen schools, about instead of going to restaurants, getting takeout food. You'll see that life is going to be a little bit more inconvenient, but if we institute these things now, the experience in other countries has been that we can really impact this and protect the health of our community, especially those who are at high risk.
Thank you very much, Dr. Kelaita, for joining us on this episode of Inside View and sharing your wealth of information with our viewers. And to our viewers, thank you for tuning in, and we hope you found this information valuable. Stay safe out there, and we'll see you next time on Inside View.
you.